Bismillahirrahmanirrahim. Quote of the day is Allah does not change the condition of a people unless they change the state of their own selves. This is the quote from Quran. My name is Dr. Aamna Khalid. I am PGR Community Medicine in Institute of Public Health. Today I will present the topic of evaluation under the kind supervision of my supervisor, Professor Dr. Saira Afsal. Learning objectives for today's presentation are: we will define evaluation. We will describe different types of evaluation. We will understand the CDC evaluation cycle and the common evaluation study designs. We will identify 5 dimensions of a good evaluation, and the members of an evaluation team will be recognized. Different evaluation frameworks, and we will explain the threats to internal and external validity. Then the practice of MCQs. So evaluation is the systematic assessment of a program, project, or policy to determine its effectiveness and impact. It measures whether the program objectives and goals have been achieved. It assesses the efficiency, relevance, and outcomes of the activities. It identifies the strengths, weaknesses, and areas for the improvement, and it provides information for decision making and future planning. So how evaluation is different from monitoring? Monitoring is continuous and ongoing, while evaluation is periodic and it's in-depth. Monitoring tracks the progress towards targets, and evaluation assess whether those outcomes have been achieved. Monitoring measures the input, activities, and outputs, while evaluation examines the relevance, effectiveness, and impact. Monitoring is operational and used in routine, while evaluation is strategic and analytical. For monitoring, we answer, are we on the track? While for evaluation, we answer, did we make a difference? For monitoring, we explain, there is an example, for example, monthly report of beneficiaries who are served. And for example of evaluation, there is end of project impact assessment. Both of these are complementary. So we classify evaluation based on the time frame, like classified into formative, midterm, and summative evaluation. And based on the process of evaluation, we classify it into process evaluation, joint, third party, meta evaluation, participatory, and self evaluation. So formative evaluation is conducted during the early stages of program implementation, and it helps to improve the program design and planning, identifies initial weaknesses or implementation problems, provides feedback for modification and improvement, and focuses on improving the program performance. Midterm evaluation is conducted in the middle of the program period. It assesses progress towards the program objectives, examines whether activities are being implemented effectively. Again, it identifies the strengths, gaps, and challenges and allows adjustments or improvements in the program strategies. Summative evaluation is conducted at the end of a program, measures the overall success and effectiveness of the program, determines whether the program objectives were achieved or not, assess outcomes and overall impact, provides information for future planning and policy decisions. Then further classifications are based on the process of evaluation. The process evaluation focuses on how a program is implemented. It examines whether activities are carried out as planned, assess service delivery and program operations, evaluates use of resources and program management, helps identify implementation problems. Joint evaluation is conducted by 2 or more organizations together. For example, it may involve government and organizations, encourages collaboration and shared responsibility, ensures transparency and mutual understanding, and produces joint findings and recommendations, and it will avoid the duplications of the services. Third-party evaluation is conducted by the independent external evaluators. These evaluators are not involved in the program implementation, ensures objectivity and unbiased assessment, increases credibility and reliability of the results, and it's often conducted by the research institutions or consultants. Meta evaluation means evaluation of an evaluation study. It assesses the quality and credibility of the evaluation methods, reviews whether evaluation is following the proper standards, determines the accuracy and reliability of the findings, and helps improve future evaluation practices. Then participatory evaluation, it involves the stakeholders in the evaluation process. For example, it will include the community members, beneficiaries, and program staff. It encourages active participation and shared decision making, improves the transparency and program ownership, and ensures evaluation reflects the real community needs. Then self-evaluation is done by the program staff or organizations. This is the internal assessment of program performance. It helps identify the strengths and weaknesses, provides a quick and cost-effective feedback, and supports continuous program improvement. So after all the classifications, now we come to the CDC evaluation framework, which starts from engaging the stakeholders. Then we have to describe the program, focus the evaluation design. Then we have to gather the credible evidence according to that design. Once the data is collected, we have to justify the conclusions. And once we are done with the making the conclusions, we have to share them and the lessons learned with the stakeholders. And in the middle, we have mentioned the standards of an evaluation, which are utility, feasibility, propriety, and accuracy. We will discuss them in detail in the next slides. So these are the 6 steps according to the CDC evaluation cycle. We have to engage the stakeholders, means we have to identify the individuals or groups involved in the program. It will include program staff, community members, policymakers, and funders, and it ensures the evaluation reflects the stakeholders' needs and interests. And then in the second step, we have to describe the program, that what are the program goals, objectives, and activities. We will identify target population, resources, and expected outcomes. And it's often summarized using a logic model. Logic model will also be discussed in the coming slides. Focus evaluation design. This is a third step where we determine the purpose and key questions of the evaluation. We will select appropriate evaluation methods and indicators. We have to define the scope and timeline of the evaluation. Then, according to all this, we will gather the credible evidence, means we have to collect the relevant data and information about program performance. Data may come from surveys, interviews, observations, or records. This data must be valid, reliable, and relevant. Then we have to justify the conclusions. This is a fifth step. We will analyze and interpret the collected data, compare results with the program objectives and standards. We have to draw the meaningful conclusions about the program effectiveness. Sixth and last step is we have to ensure the use and we have to share the lessons which are learned during the process. Means we have to communicate the findings with stakeholders and decision makers and use these results to improve programs and inform future planning. These are the standards of evaluation which were mentioned in the center of the CDC cycle. First of it is utility. Which means we have to ensure that evaluations serve the needs of the intended users. This includes the evaluator credibility, stakeholder identification, clear values and criteria, timely reporting. Then second one is feasibility. This ensures that evaluations are realistic and prudent. This involves practical procedures, political viability, and cost effectiveness. Third one is propriety, that ensures evaluations are conducted legally and ethically, includes formal agreements, human rights protection, balanced reporting, conflict interest disclosure. Then fourth one is accuracy, that ensure evaluations reveal and convey technically adequate information, involves valid information, reliable measurements, systematic inquiry, and justified conclusions. Then the next thing is program evaluation process. This framework or the process was based on the Rosie, Lipsey, and Freeman framework established in 2003. It involves 5 steps. The first step is needs analysis. This is a diagnostic step which determines if there is a need for a program and what the consequences of the program are. The next step is program theory assessment. It focuses on how the program is conceptualized. Comparison is done with the similar programs in literature. Third step is program process assessment. This focuses on quality of current program operations, program mix, that how skills are mixed, and all of the skills are involved, efficiency, service efficacy, and so on. Fourth step is impact assessment. This examines the effect or impact of a program at specific points in time during or after the program life. Fifth step is efficiency assessment. We have to study the return on assessment investment or cost benefit analysis. Means we are doing the cost effective analysis and different evaluation methods that was it beneficial, was it efficient. Then, as we discussed in the CDC evaluation cycle, that we have to adopt a specific evaluation designs. Now we will see that there are different evaluation designs from which we can opt any one of them. There are seven designs: one-shot design, retrospective pretest, pretest post-test one group, pretest post-test control group, time series design, post-test only with control group, and case study design. So the first design was one-shot design. Data is collected only once after the intervention. There is no baseline or comparison group. So limitation of this design is that we can it cannot be sure that change is due to the program. Second design is retrospective pretest design. Participants enrolled in the program are asked to recall their status before the program. So limitations here is the recall bias. Third design is pre-test, post-test one group design. Data is taken before and after intervention in the same group, and it shows changes over the time in the same group. There is no control group. So as there is no control group, limitation is that the other factors may influence the results, which we will not be able to identify. Fourth design is pre-test, post-test control group design, where there are two groups, intervention and the control group, and both are measured before and after the intervention. This is a strong study design to assess the effectiveness. Fifth design is time series design, where data is collected before, during, and after intervention, and it identifies the trends and the sustained effects of that program, and this is good for long-term monitoring. Sixth one is post-test only control group design, where there are two groups, the intervention and the control group, but the data is collected only after the intervention. So there is no baseline comparison within the groups, yeah, to see the change. Seventh and last design is case study design. This is the in-depth evaluation of a single program, and it provides a rich detail about each and everything. But the problem with this design is limited generalizability. While studying and collecting the data, there are some threats to the internal validity. Means there are some factors that affect whether the results are truly due to the intervention we are doing. These include history. There are some external events during the study that may influence the results. For example, a TV health campaign during the program. Then the second one is maturation. This is the natural change in the participants over time that affect the outcomes. For example, children gaining knowledge as they grow. Third one is testing effect. Taking a pre-test may influence participants' performance on the post-test as well. Fourth one is instrumentation. Changes in the measurement tools or the data collection methods may affect the results. Then we have selection bias. Difference between groups before the intervention may influence the outcomes. Then there is attrition, that is dropout. Loss of participants during the study may distort the results. Then there are some threats to the external validity, means the extent to which the findings can be generalized to other populations or settings. Again, selection bias, that the results may not apply to other populations if the sample is not representative of the broader group. Then we have the have-thorn effect. Participants may change behavior because they know they are being observed or studied. Then there is testing effect that the pre-test may influence participants' responses, limiting the generalizability of the findings. Then the environmental differences. Results obtained in one setting may not apply to different environments or context or people or the time durations. Interaction of selection and treatment. The intervention may be effective only for the specific group studied, not others. So evaluation team has different members. For example, evaluation manager or the team leader who leads and coordinates the entire evaluation process, plans the activities and supervises the team. Then the subject matter experts, they provide technical knowledge related to the program and they help in interpreting the findings in context. Then we have the data analyst or the researchers. They are responsible for the data collection, analysis, and interpretation. They ensure the reliability of the results. Then program staff they provide information about program activities and implementation details. The stakeholder representatives, they may include community members, beneficiaries, or policymakers to reflect target population perspectives. There are five dimensions of a good evaluation. An evaluation program must be relevant. That how the program addresses the needs and priorities of the target population. Are the objectives appropriate for the health problem? Second one is effectiveness. The extent to which the program achieves its stated objectives. Were the planned outcomes and results successfully reached? Third one is efficiency. How well resources, the time, money, manpower, everything, they are utilized. Were the results achieved with minimum possible cost and effort? Fourth one is impact. The overall long-term effects of the program on the population. That includes both the direct and indirect changes in the health status of the people. Fifth one is sustainability, whether the benefits can continue after external support ends. Can the program be maintained by the community or the local systems as well? So this is the sustainability. All of these five components will be present in a good evaluation. Now we come to the almost the last thing, which is the evaluation frameworks. There are four frameworks which are used. Frameworks actually help us understand the relationships between program elements, including inputs, processes, outputs, and environmental context. The first one is conceptual framework. I will go to the next slide. We will see the detail of each framework. Conceptual framework. And the key features of this framework that it is theoretical or the causal framework. It illustrates the relationships between all the relevant systemic, organizational, individual, and other factors. This clarifies the why and how questions of the program design, and it can be used to define goals and objectives. It helps in understanding the problem and designing the program goals. This is also called proximate determinants framework. So on the right side, there is a flow shown that how individual characteristics are considered first. Then we focus on the service utilization. Then we see the institutional capacity and how a program can supply it. And then at the end, we see the healthy practices, and the impact of them on the health status of the people. The second one is results framework, also called the strategic framework. Key features of this framework are that it diagrammatically shows the relationships between incremental results. This is the key point of it. It shows the relationships between incremental results of key activities all the way to overall objectives or the goals of the program. For example, we move from the objective activities to the intermediate results or the incremental results, and then we see the improved health status. Intermediate results, abbreviated as IR, this represents a measurable step towards the overall strategic objectives. They can also be subdivided into the sub-IRs, means sub-intermediate results. For example, it may include the facilities that are being provided, equity, either it's considered or not, the provider performance, how it's going or assessed. Then there is on the I have mentioned a hierarchical structure example. The goal is improved health status, and the strategic objectives are the improved use of health services. To achieve this goal, four different intermediate results are focused: the access, quality, sustainability, and demand of the services. Right. The third one is logic models. This is a simple illustration showing the linear relationships flowing from program inputs, processes, outputs, and then outcomes. For example, if we take the example of malaria, that we have to reduce the malaria incidence and prevalence, then the inputs may include the strategies that are being adopted, the policies, guidelines, funding, materials, facilities, commodities, supplies, and the staff. uh, at the second level, we have to see the process which is going on, that how many trainings are going on, services being provided, education being done, treatments and interventions. Outputs involve the services, how they are delivered, knowledge, skills, and practice, the sprays that are being done, and the prevention treatments that are being delivered, anti-malarials that are delivered, and so on. The outcomes then are they are measured at how many much indoor residual sprays ownerships we have, and the treatment based on the parasitological confirmation. The overall impact then will be studied, that how all of these things have affected the malaria incidence or prevalence, the mortality, the socioeconomic well-being, and the economic impact of this program on the malaria. All right. The last one is a logical framework, also called log frame. This is although similar to logic model, but this is the detail, in a sense that it is a structured planning and evaluation matrix. This shows the relationship between goal, purpose, outputs, and the activities. Uh, how it is different from logic model, because it also includes the indicators, how they are verified, the means of verification of those indicators, and the assumptions we derive from them. This is used for the detailed program planning, monitoring, and evaluation, and this is commonly used by the international organization and the donors. I have shown an example at how on the left-hand side we have the program level, including the goal, purpose, outputs, activities being done, and then we will set specific indicators to study each of them. That how we will study how a specific indicator will show a specific a thing to us, that either it's achieved or not. Then we have this means of verification of that indicator, and then we have the assumptions regarding it. So this was all about the evaluation. Now we come to the practice of MCQs. The first question is, a malaria control program uh, conducts an assessment during the first 3 months of the implementation to identify problems in training and logistics so the program can be improved. What type of evaluation is being conducted? Option A, summative evaluation. Option B, formative evaluation. C, impact evaluation. D, efficiency evaluation. E, meta evaluation.
D.
D. Option B is the right answer, formative evaluation, as it's being done in the first 3 months of implementation. Question number 2. At the end of a 5-year HIV prevention program, researchers analyze whether HIV incidence decreased in the target population. This evaluation is called option A, formative evaluation, B, process evaluation, C, summative, D, participatory, E, joint evaluation.
C.
Yes, C is the right answer. Summative, it's done at the end of the program. Question number 3. During a vaccination campaign, evaluators assess whether vaccines were stored properly, staff followed the protocol, and services were provided as planned. Which type of evaluation is this? Option A, impact evaluation. B, process evaluation. C, midterm evaluation. D, efficiency evaluation. E, meta evaluation.
B.
Yes, B is the right answer. Process evaluation. Question Question number 4. An evaluation framework illustrates the sequence of program elements starting from inputs, then processes, outputs, outcomes, and impact. Which framework is being used? Option A, conceptual framework. B, results framework. C, logic model. D, logical framework. And E, strategic framework.
D.
C is the right answer, which is logic model. D would be right when we mentioned that there are some specific indicators and we have set some means of verification of them and we will assume the results. Then we will opt the logical framework. Question number 5 is a study measures malaria incidence repeatedly before, during, and after the implementation of a vector control program to observe trends over time. Which evaluation design is being used? Option A, one-shot design, B, time series design, C, case study design, D, retrospective, E, post-test only design.
Time test.
Yes, time series design. Question number 6 is a malaria control program collects data through surveys, interviews, and health records to evaluate program performance. Which CDC evaluation step does this represent? Option A, gather the credible evidence. B, focus evaluation design. C, justify conclusions. D, describe the program. E, engage stakeholders.
A.
Yes, A is the right answer. We are collecting the data, so it's gather the credible evidence. Question number 7. A group of experts reviews several evaluation studies to determine whether the evaluation methods used were scientifically sound. This process is called option A, process evaluation, B, efficiency assessment, C, meta evaluation, D, impact evaluation, and E, participatory evaluation.
C.
Yes, C is the right
Charlie.
answer. Yes, Charlie is right. Eighth one is a public health officer analyzes whether the cost of a dengue control program is justified by the number of the cases prevented. Which type of program evaluation does this represent? Option A, needs analysis, B, program process assessment, C, efficiency assessment, D, program theory assessment, and E, impact assessment.
C.
Yes, C is the right answer. Question number 9 is before launching a mental health program, planners assess whether depression is a major problem in the community and estimate its consequences. This step in evaluation planning is option A, impact assessment, B, needs analysis, C, program theory assessment, D, process evaluation, E, efficiency assessment.
Need analysis.
Yes, needs analysis is the right answer. Question number 10. A health team studies whether a diabetes program actually reduced complications among patients after 2 years of implementation. This represents option A, process assessment, B, impact assessment, C, efficiency assessment, D, meta evaluation, E, need assessment.
Beta. B.
Yes, B is the right answer. We are focusing on how the program has impacted. All right, this is the answer key. This is a YouTube channel of IPH, Institute of Public and Lahore, where this presentation will be uploaded later on. Thank you so much.
Thank you very much. Very nice presentation. However, I must appreciate the effort, and there are few things